Hello, and welcome to Student Health Services at Loyola Marymount University. Student Health Services is a full-service medical office and is accredited by the Accreditation Association for Ambulatory Healthcare. We are conveniently located in the Burns Recreation Center and are open Monday through Friday from 8 a.m. to 5 p.m. with extended hours on Wednesdays until 7 p.m. during the academic year. Our healthcare team includes a board-certified physician, nurse practitioners, registered nurses, an X-ray technician, medical assistants, and experienced support staff. We offer a wide range of primary healthcare services, including treatment for common illnesses and injuries, as well as preventative care such as vaccinations. We are able to perform a number of procedures when needed, such as X-rays, EKGs, lab work, etc. We also have immunotherapy clinic, i.e., allergy shots. This service is limited to 12 to 15 students per semester, and they must have an allergist who sends us the antigens and schedule. We do not initiate the therapy. For students with more complex health or chronic health conditions, we may refer and co-manage these cases with our network of nearby specialists, such as cardiologists, endocrinologists, gastroenterologists, and orthopedics. As you know, personal health information is protected information. And for students 18 and older, this information is kept strictly confidential in Student Health Services. We do not release any personal health information about a student to a third party without the student's signed permission, unless it is an emergency, in which case the parent or a legal guardian will be notified. All students must be enrolled in 6 or more units in order to be eligible to use our services, no matter which health insurance plan the student or you as a parent have. Our charges are nominal and reasonable. First, there is no charge for the healthcare provider's services. That is, there is no office visit fee. However, you may incur expenses for laboratory tests, X-ray, procedures, medicines, and medical supplies when needed. For example, if your student visits our healthcare center with a sore throat, they will not be charged to be seen. That is, there is no copay. But if we culture the throat or dispense medicine, charges will be incurred, and these charges are posted to your student's account. We do have a small medication dispensary in the health center that is stocked with commonly used, mostly generic medicines. Thus, we are able to prescribe and dispense medicine at the time of the visit. This makes it very convenient for your student to get the care and treatment they need. Alternatively, they may ask for a written prescription and take it to a community pharmacy if that is preferred. Student Health Services does not bill any health insurance plan directly. However, we can provide a list of charges with the required diagnosis and procedure codes that can be submitted for reimbursement to your health insurance plan. It is very important that all incoming students, including first-year transfer and graduate students, comply with our entrance requirements in order that we may ensure our LMU community is healthy and protected from communicable disease. The requirements may be met by visiting the MyHealth portal. The deadline to visit the portal and submit the required documents online is August 1st, 2019. To access the MyHealth portal, log into my.lmu.edu. From the top menu, choose System Logins and select My Health. The 4 entrance requirements include: review and indicate the consent for treatment. If the student is under 18, they will need a parent or legal guardian to sign the consent for treatment of a minor. Review and acknowledge the Notice of Privacy Practices. 4. TB screening and testing. Students who are not born in a country with high incidence of active TB just need to complete the TB screening questionnaire. However, students born in a country with high incidence of active TB, or for any student who answered yes to any item on the TB questionnaire, must show proof of TB skin or blood tests in the last 12 months, first by entering the date of the test on the immunization entry form on the MyHealth portal, and then uploading documentation of the test onto the portal. Further, if the TB test is positive, the student will need to upload a copy of a chest X-ray. To see the list of countries designated by the World Health Organization as being high risk for active TB, please visit the Student Health Services website. Finally, all students must provide documentation of 2 measles, mumps, rubella, MMR immunizations, or proof of immunity by uploading a copy of their records to the MyHealth portal. Please allow 1 to 7 days for Student Health Services to process all documents once the entrance requirements are completed. Additional vaccinations are recommended but not required. There will be a campus-wide flu clinic during the fall semester, and we encourage students to participate. What happens if your student becomes ill or gets injured when Student Health Services is closed? The first thing to do is call the Department of Public Safety at 310-338-2893. Public Safety will dispatch our team of certified EMTs who will provide assessment and emergency first aid as needed. If the health concern is more serious, you may be directed to the nearest urgent care or hospital emergency department. A list of nearby urgent care facilities and hospital emergency care facilities is listed on our website, www.lmu.edu/health. We strongly recommend and advise that students always carry their health insurance ID card at all times in case of an emergency. If your student has a pre-existing or chronic health condition, we recommend you request a letter from your student's treating healthcare provider that outlines or provides a summary of diagnosis and treatment thus far, and their recommendation for ongoing care while they are attending LMU. You may mail, fax, or email the letter to our Administrative Director, Katie Arce, or our Health Director, Dr. Dan Hislop. For questions regarding services or entrance requirements, please contact Student Health Services. Thank you, and welcome to LMU.